This is Greg Remke with Economic Thinking, and this is from a presentation given at the Summer University at Aix-Marseille University in July, Entrepreneurs, Nutrition, and Reforming Healthcare. I have these posts on economicthinking.org/health-nutrition. I'm the author of a policy study from the Goodman Institute, Did the Government Make Us Fat? And I post at normalnutrition.substack.com. So I do workshops for high school and homeschool speech and debate students. Last year we had energy policy as one of the topics for the STOA Homeschool Debate League. And then this year their topic is healthcare reform, reforming federal healthcare policy. So I'm going to try and combine the first, or at least start with energy policy and lead into healthcare policy. So first, notes on energy. Last year my talk, also at Summer University, was exploring the energy race, encouraging innovations and institutions to compete for cleaner, more reliable, more affordable energy. So the argument is we have competing fuels, energy sources for our homes, our cars, our factories, and we have a knowledge problem. That is, we don't know which is the best technology or which will advance the most quickly. So we want a institution of economic freedom that encourages innovation and allows consumers to pick the energy they prefer, the energy source they prefer, and enterprises to try out new energy sources and transmission and so forth. However, governments, federal at state level, try to nudge consumers to pick the energy they think is best and try to pick energy winners in their political jurisdictions with subsidies and regulations and taxes. And most of these efforts, at least so far, have failed. And that was discussed for last year's energy topic, and those challenges still exist today. Similarly, though, we have competing fuels to provide energy for our bodies. We have a choice of fuels, that is foods. We can eat carbohydrates, for example, or proteins or fat. In fact, we need basic macronutrients, but our choices of how we get these, whether we have cereal for breakfast or bacon and eggs, or whether we choose not to eat breakfast and wait until lunch to break our fast. Food companies similarly compete in providing foods for us, but again, federal and state governments intervene to nudge us towards certain foods and to pick winners, to regulate, subsidize, and so forth. Now, this is relevant because current policy, nutrition and healthcare policy, are tied with programs that affect the food we eat, and the food we eat impacts our health. In fact, critics say most of our chronic diseases now are lifestyle diseases. So I have a series of short videos on this, food and energy follies, and a playlist on economicthinking.org/ youtube.com/economic thinking. So energy and food policy follies. Energy is the master resource. Modern economies require clean, affordable, reliable energy sources. But also human beings are the ultimate resource, as Julian Simon emphasized in his first book, The Ultimate Resource, and his follow-up collection of essays, Ultimate Resource 2. What are the best fuels for communities? Well, we have energy enterprises again to discover, innovate, compete, even against states that tax and regulate and so forth. On the human side, our human energy is complex. We gain energy from biochemical sources. We have electrical as well as biochemical energy inside, and we're really different inside. This is something to emphasize, something of biochemical individuality. Our stomachs are in different sizes, different places from person to person. Our intestines sometimes are 4 feet long, sometimes twice, 3 times as long. Our mental systems work differently from person to person. Our sense and smell and taste vary from person to person. Our eyesight, even the pain we feel is very different. Boxers, for example, most boxers, 90% I think feel pain much less intensely than the rest of us, which is why they apparently pursue careers where they get hit in the face from time to time. Our brains and our bodies are different. So this is individuality and biochemical individuality, which the author and biochemical researcher Roger Williams emphasizes in his book, Nutrition Against Disease. Now, on the plus side, critics of the system say it's a sick care system. We don't really have a healthcare system. Our system provides pills and surgery and so forth for people already sick. A healthcare system would be one that takes preventative action or encourages lifestyles that maintain health. Now, this is not to be a criticism of the pharmaceutical industry. They develop amazing new drugs that developed, and those are life-saving in many cases. Amazing new medical devices and surgical procedures are developed. I broke my wrist playing basketball, and through the magic of my surgeon and titanium implants, my wrists are at full strength, maybe stronger with titanium. But there are new healthcare entrepreneurs that have arrived, and they are leading to a revolution in the healthcare, the true healthcare industry. And that's what I'll talk about in my presentation, mostly. But in the beginning, we have a challenge in the status quo. We have a wealthier world, but people are suffering more from chronic or lifestyle diseases in the Americas, in Europe, in India, and China as well. Mainly, and we have drugs to treat high blood pressure, type 2 diabetes, depression, obesity, anxiety, autoimmune diseases. But these are all symptoms of disease rather than the source of the disease itself. So the alternative is to deploy nutrition against disease. And this leads us to investigate the causes, which most seem to agree are inflammation and insulin resistance, stress, lack of sleep, low vitamin D. And so here are the resources I'm going to recommend. nutritioncoalition.us, books from Nina Teicholz and Gary Taubes, who are science journalists, who write The Big Fat Surprise for Nina Teicholz, and Good Calories, Bad Calories by Gary Taubes. My essay reviews these, Did the Government Make Us Fat? And that link is available at the Goodman Institute. Low Carb MD podcast and Life's Best Medicine podcast with Brian Lenskis and Tro Kazanjian for Low Carb MD. The Society of Metabolic Practitioners, or doctors who focus on metabolic health. Metabolic Mind is looking at the metabolic causes or sources or connections with brain disorders, depression and anxiety, challenges with brain energy. So in this presentation, I'll be talking about this. I'm going to finish this brief introduction by recommending Nina Teicholz's video, The Big Fat Surprise, given at the Cato Institute, where she reviews her book that was published a few years earlier, The Big Fat Surprise. Terence Keeley, who introduces Nina Teicholz at Cato, is author of the book Breakfast is a Dangerous Meal. And you can see the link here for that in my Normal Nutrition podcast, or Substack looks at all these issues. But the core issue, Terence Keeley outlines it in his book. He's fairly healthy and fit, but discovers he's got type 2 diabetes. He goes to the doctor, and the doctor prescribes eating lots of whole grains. He does research, and the research suggests not eating any whole grains, dramatically reducing his carbohydrates and not eating breakfast. But the nutritional status quo says breakfast is an important meal. The critics say the cereal industry has influenced the federal dietary guidelines in the US and Europe. So as a debate for students on healthcare, understanding how we eat and the relevance of how and what and when we eat to our health seems to me critical for understanding on reforming the U.S. healthcare system. So here's the initial link, and I'll come back with more in the second segment here. Thank you very much.